Hello, thank you all for joining me today. We are going to review the Benchmark Games International Open Enrollment for October 1st, 2020, extending through September 30th, 2021. This is your one time during the year to make any changes to your plans, to your covered dependents, no questions asked. If throughout the course of the year you experience a qualifying event, such as marriage, divorce, your spouse loses coverage at their job, spouse gets a new job and then is newly eligible for coverage, that's the only time you guys are able to make changes during the calendar year, during your benefit year. However, you do need to notify us within 30 days of the date of the event in order to make the change. Please keep in mind that while you can change the individuals that are covered underneath your plan itself will remain the same. So it is important that you understand your benefits. And if you have any questions, please do not hesitate to reach out to myself, Colleen Hernandez, or Debbie Rito in my office. Before I jump into all of the benefits, I did want to just inform everybody that the same exact benefits from last year are going to be offered again this year. No changes to your benefits at all whatsoever. So if you are happy with the plan you're currently enrolled on, you will have the option of continuing again under that plan for this year. Without further ado, let's get to reviewing those benefits. Everybody's looking at the benefits at a glance up on my screen. The bottom of page 1 is a refresher on how you can locate a participating provider within the Blue Cross Blue Shield network or the Guardian network for your dental. As a reminder, you are eligible for the medical, dental, non-401k benefits, first of the month following 60 days from your date of hire. The waiting period for the 401k is first of the month following 12 months of employment, and we'll get into that a little bit more later. Medical plan, you're able to cover dependent children until age 30, no questions asked. Dental and vision only covered until age 26. Let's look at page 2 so we can review your different benefit options. As a reminder, same 6 plans from last year are being offered again this year. The plan in column number 2 and the plan in column number 4 are Florida-only plans. So if you reside outside the state of Florida, you will not have the option to enroll in that plan, and you will not see that in your enrollment window. You'll only have the option of the 4 blue options plans. Just want to take a couple of minutes to point out some differences between the plans, highlight some important features. The plan number in column number 1 is the Blue Options PPO 5302 plan. Great plan. You're going to have copays for the doctors, specialist, emergency room, urgent care. Deductible and coinsurance will kick in when you're having hospital-related services. Your deductible is $5,000 for an individual, not to exceed $10,000 for a family. Then 30% coinsurance until you reach your out-of-pocket maximum of $6,350 for an individual or $12,700 for a family. So a couple things I wanted to say right now about your deductible and out-of-pocket maximum. These 2 features are both a calendar year feature. What that means is anything that you will have already accumulated to either during the 2020 calendar year will remain with you through December 31st of this year, December 31st, 2020. Come January 1st, both your deductible and out-of-pocket maximum will revert to 0. It will restart. Another thing that I wanted to mention about the deductible and out-of-pocket maximum on almost all of the plans, and I'm going to tell you which plan is different in a few moments, is that, as a reminder, one individual within your family unit will not exceed that individual deductible or individual out-of-pocket maximum. And then collectively as a family unit, you will not exceed the family deductible and family out-of-pocket. Last thing I wanted to mention about, last two things that I wanted to mention about this plan is number one, this plan does allow for out-of-network coverage. It is going to be more expensive to you, and you could be balance billed. So I always say in-network, in-network, in-network. Next thing I wanted to mention is that this is a generic only prescription drug program. So if you are an individual that takes name brand medication, you may want to consider one of the other plan options. Take a look at the plan in column number 2. Again, copay plan has a lot of copays, including doctor's office, emergency room, urgent care. It also introduces a copay for advanced imaging on this plan, as well as outpatient surgery. As mentioned earlier, this plan is an HMO plan. However, you do not need a referral to see a specialist. So let's say I fall and I think that I broke my toe and I want to go directly to an orthopedic. I can just pick up the phone, make an appointment, and go straight there. I do not need to see a primary care doctor, and I do not need a referral. And then as a reminder, this plan does not have out-of-network coverage unless there is an emergency situation. In the event of an emergency, please go to the closest emergency room. It does not matter if it is in-network or out-of-network. It'll be treated as if you were in-network. However, that does not mean I have a little cold, I'm not feeling well, I'm going to go to the emergency room because my doctor's office is closed. That would not be a covered visit, and you would be on the hook for everything. This plan does have a full prescription drug card. So if you take brand name drugs and you reside within the state of Florida, this is a plan that you may want to consider. Next, the plan in column number 3, the Blue Options PPO 316061. This plan does not work like any of the other plans. This is a high deductible health plan, which is an HSA eligible product. On this plan, you are responsible 100% for all covered services, with the exception of preventative care, up until you reach your deductible. The deductible on this plan is $1,400 for an individual, then 20% coinsurance until you get to your out-of-pocket maximum of $5,000. This plan does not have the individual protection like the other plans do when it comes to deductible and out-of-pocket. So that means is if I enroll just myself, I'm responsible for the $1,400, then 20% until the out-of-pocket maximum of $5,000. However, if I enroll myself with spouse and or children, then we have to meet the $2,800 before that 20% kicks in. So one person on the plan could pay the $2,800, or collectively as a family unit, the $2,800. However, there will be no coinsurance until you reach the $2,800. This plan does have out-of-network benefits, but again, in-network, in-network, in-network whenever possible. And after you satisfy your deductible, then you'll have copays for any covered medications, including brand name drugs. We are going to look at the 4th plan, which is the Blue Cross Blue Shield Blue Care HMO 61. Again, this is another Florida-only plan, so you must reside within the state of Florida in order to use this plan. This plan has lots of copays, including a new copay for inpatient hospitals that I want to talk about. On this plan, you have a $850 copay per day that you're within the hospital to a maximum of $4,250. So that's a little different than the other groups. So I did want to point that out. 1,250 individual deductible. You have that cap of $2,500 for the family, 20% until you get to the out-of-pocket maximum of $5,000 for an individual or $10,000 for the family. Emergency only coverage outside the state of Florida, and you have a full drug card. Last two plans, the PPO 5301 and the PPO 5771. They are both copay plans. They work the same way. Anywhere you see a copay, that's all you're going to be responsible for. Anywhere that you see deductible and coinsurance, you first have to submit your deductible, and then you pay your coinsurance up until your out-of-pocket maximum. Both plans have out-of-network coverage and full drug card. Overall, I want to just point out a couple of things on the plan. If you take your finger and you draw a line from where it says emergency room and then you look to the right, you'll notice most of these plans have copays. The HSA eligible plan, the high deductible 316061, you are responsible for deductible and coinsurance. Underneath that, let's take a look at urgent care. We're going to draw a line. You'll notice again copays on everything with the exception of the high deductible health plan. Now let's look at the difference in cost between those two. You will notice a substantial savings if you visit an urgent care versus an emergency room. The urgent care centers can now do a lot of the same things that an emergency room can do, including x-rays. They can stitch you up, so you do need to decide where is going to be the most cost-effective place for care and treatment for you as an individual. Another thing that I want to mention, and we're going to talk about that in a little bit more detail a couple of pages back, is going to be the telemedicine benefit that's built into each and every one of these plans. Right now, the cost is waived for the use of the telemedicine plan through the end of October. So with that being said, right now you can seek care and treatment with Teladoc absolutely free of charge. Once the cost share is reinstated, then it's for as little as $10 on any of the copay plans, and then a substantial savings, probably about 45-ish or so on that PPO 316061 plan. If everyone takes a quick peek at page 3, this is going to be some information on how you can save monies on prescription drugs. Number 1, Walmart, Winn-Dixie, they offer $4 30-day generic medication and $10 for a 90-day supply. You do not even need to have insurance in order to take advantage of these savings. Also, Publix gives you free antibiotics and some routine maintenance medication absolutely free of charge as well. And then there is GoodRx. GoodRx is a wonderful tool, especially if you elect the PPO 5302 generic only plan, or if you elect the PPO 316061 plan, where you're responsible for paying 100% of your prescription drugs until you satisfy your deductible. GoodRx is a website that you can visit, and you're going to type in the name of the medication that you're taking, and it will point you to the closest pharmacy that carries the medication and the cost for that drug there. And then, if there is a manufacturer coupon, there will be a link right on the site to take you to download a copy of that coupon. Again, this is going to be a great savings if you don't have any coverage for name brand medication, or if you're responsible for the cost 100% for that name brand medication. So keep this handy. Next, page 4 talks about the Florida Blue Clinicistas. And on the Clinicistas, these are Blue Cross Blue Shield owned facilities. You have a variety of different locations within Florida, and more locations are opening up every year. So becoming an even more valuable resource. You can locate a participating facility by visiting the Clinicinista site and typing in your zip code. There's a variety of different types of services. Some of them have primary care. Some of them actually have x-rays and CAT scan machines on property. Some of them have urgent care on site. So this being a member of Florida Blue owned facility, you are going to see great savings, including a primary care visit for as little as $5. So substantial savings if you choose to go to a Clinicinista as opposed to any one of the other participating providers. Page number 5 talks about the teledoc, which I had briefly mentioned. The costs are waived currently due to the coronavirus pandemic. This provides you with 24/7 access to an actual medical doctor. Great for, hey, I might have a sinus infection. I have this rash. I think maybe I have tonsillitis. Maybe you just want a second opinion. Do you think I need to go somewhere? Do you think I can wait a little bit? Not good for, hey, I slipped, I fell, I hurt my back. I really think I need some painkillers. Unfortunately, you're going to have to go to a face-to-face visit, as teledoc cannot prescribe any pain medication. However, they can prescribe prescription drugs. Meet with your doctor. They call in the prescription. It'll be at your pharmacy before you even get there. Page number 6 is a review of your dental plan. 2 different dental plans to choose from. The first one is going to be the DHMO plan, and the second one is the PPO plan. The DHMO plan is an in-network only plan. You must pick a participating provider and can only seek care and treatment from that provider. You can change your provider at any point in time. However, you must first pick up the phone and change your provider prior to seeing the new dentist you would like to change to. If you call prior to the 15th of the month, you are going to be fine to see that new provider the 1st of the next month. If you call after the 15th of the month, it's going to be the 1st of the 2nd month before you're assigned to that new dentist. So just try not to wait, and as soon as you know that you're unhappy with your dentist, pick a new one that you would like to go to. The DHMO plan, there is no deductible and it's unlimited calendar year maximum. That means as long as you need a covered service, you're going to be responsible for your copay amount, and Guardian will go on ahead and continue to give you the discounts throughout the year. This plan also has orthodontia coverage for both children and adults. The next plan, the PPO plan, has a larger network of in-network dentists to choose from, and you also have the option to go to an out-of-network dentist if you so choose. Within a calendar year, so your benefits will restart on January 1st, you are given $1,000 to use for each and every covered member. If you have already exhausted your $1,000 for the 2020 year, you will have to wait till January 1st, and then you'll have the new $1,000 available to you. Since you guys have been with Guardian for quite some time, it is possible that you will see an additional calendar year benefit in your bucket if you have used the plan and Guardian has not paid more than $500 for your care and treatment that year. Then they're going to reward you by giving you an additional allowance of either $250 or $350 if you stayed within the network as a thank you for exercising good overall dental hygiene. Then any basic services, including fillings, periodontal scaling and root plant, and root canals. In the network, you're going to be responsible for 20% after the deductible. Out of the network, you're responsible for 30% after the deductible. Major services, it's going to be 50% after the deductible, and out of network, major services at 60% after the deductible. When we come to your preventative services at the top, you'll notice that your exam and your cleaning covered free of charge within the network. Out of the network, though, you're responsible for 20% of the contracted rate, but you do not need to satisfy your deductible first. So you're just going to be a straight 20% of whatever the balance is. Also, orthodontia on the PPO plan is for children only. Children under the age of 19 only. And you're responsible for 50% after deductible, not to exceed $1,000 lifetime maximum. Now, regardless of which dental plan you elect, you'll be enrolled in the Guardian College Tuition Benefit Program. You must visit the website, which is at the bottom of the page and on the last page, but it is www.guardiancollegetuitionbenefit.com in order to register and receive the points that year. You are then given, as a thank you for being enrolled in the dental product, 2,000 points, which equates to $2,000 to use towards a qualified beneficiary's college education. Qualified beneficiaries are going to be children, grandchildren, niece, nephew, godchildren. So essentially any child that you can get their name, address, birthday, and name, address, birthday, and date of birth. You're able to register them as a qualifying beneficiary. A couple important things that you must keep in mind. Number one, you need to register for the site prior to 6 months after your effective date. So within 6 months of October 1st, you must register for the site in order to receive the points. If you are already registered, you do not need to do anything this year and the points will automatically happen. In addition to that 2,000 points, you're given 500 extra bonus points for each child that you register. All children must be registered prior to them entering the 11th grade year, and you must choose whether or not you want to use that money for that child before they enter the 12th grade year. Even if you do not have a beneficiary right now to use that money for, please register anyway, because one day you will, whether it be your niece, nephew, your neighbor's child, whoever. Let's just start accumulating that money. Great benefit we don't want you to miss out on. Next is going to be your vision. Vision is through Guardian and utilizes the VSP network. Coverage allows for an eye exam, new lenses, and new frames every single year. You do have the option of going out of network as well. However, the VSP is a large network that includes both providers and retail chain places, so you really should not have an issue staying within the network. However, again, if you want to go out of the network, you may do so. Out of the network, you're going to be responsible for 100% of the bill. Then you'll have to complete a claim form and send it in for reimbursement. Next is going to be the preferred legal benefit that we've offered for multiple years now. Enrollment in this preferred legal benefit covers not only you, but all individuals that reside in your household. So for as low as $149 a week, you're able to get a lawyer on retainer, essentially. The preferred legal team, they're able to help with a variety of different legal types questions, including writing letters if you have somebody complaining that your dog is barking at 3 o'clock in the morning, or your neighbor's dog is barking at 3 o'clock in the morning. It just, when it's on legal letterhead, sometimes those letters do a lot more than you walking over and knocking on the door yourself. Also, if you get a ticket, though the representation within court is not covered, no charge, it is a very reduced rate because you're enrolled in the preferred legal program. Next thing that I want to talk about is the health savings account. You can only enroll in the health savings account if you are enrolled in that 316061 high deductible health plan. You're then eligible to contribute $3,550 for an individual, or $7,100 if you were enrolled with family coverage for the 2020 calendar year. 2020. 2021, the individual is going to be $3,600, and the family is at $7,200. Plus, if you're over 55, you can contribute an additional $1,000. This money is contributed on a pre-tax basis and then can be used for qualified medical expenses. Keep in mind that qualified medical expenses also cover dental and vision expenses. If you are not enrolled in that health savings account, you are then eligible to enroll in the flexible spending account. This money is also used for qualified medical expenses, including medical, dental, and vision expenses. However, the maximum is a lesser amount. Your 2020 maximum is $2,750. The 2021 maximum has yet to be released, but we will inform you as soon as we have that. Also, there is a dependent care account where you're able to put $5,000 in tax-free for the care of a dependent child under the age of 13, or someone over the age of 13 who is incapable of caring for themselves. Again, this money is tax-free, can be used for aftercare once schools reopen, can be used for summer camps, it can be used for daycare expenses. Page number 8, the accident plan. Accident plan is offered to you through Guardian. It is going to pay you a lump sum based upon the type of accident you have sustained and where you seek care and treatment. In addition, there is also a death benefit that will pay out if you or a covered spouse or child lose your life as a result of an accident. If you are sick, this benefit will not pay out. Again, it is only paying you if you are injured outside of the workplace and injured accidentally. Next, we're going to talk about life insurance. Benchmark offers all full-time employees $25,000 worth of life insurance free of charge, with a matching $25,000 accidental death and dismemberment benefit. However, if you do not feel that $25,000 worth of life insurance coverage is adequate for you, you'll have the ability to purchase additional life insurance for yourself, your spouse, or your dependent children. You can purchase for yourself anywhere from $10,000 to $200,000 worth of coverage. If this is your first time being eligible for the benefit, the first $150,000, no questions asked. If you elect anything over $150,000, or you were eligible for this in the past and you declined, or you want to increase the volume of life insurance you're purchasing, you will need to complete the evidence of insurability form. Only if you enroll in the voluntary life can you elect to enroll a spouse. Your spouse can take 50% of the amount you chose for yourself, not to exceed $100,000. Again, same thing. If you were already eligible for this benefit and you waived it for your spouse, or you're increasing the volume, you will need to complete an evidence of insurability form, which can be found online. Next is the dependent child life insurance. You can purchase anywhere from $1,000 to $10,000, but again, you must first purchase life insurance for yourself in order to purchase the life insurance for your dependent children. Each and every single employee, including part-time employees, are eligible for the Employee Assistance Program. The Employee Assistance Program is from Guardian. They are able to help with a plethora of different things. They have 24/7 online and telephonic help. They can help you with different things, including finding a good school for your child. Maybe you need an adult daycare for a parent that you're caring for. Maybe you want to build a budget so you can save for a house in the future. Maybe you had questions regarding immigration. I mean, wide variety of topics. The EAP also provides 3 free face-to-face sessions with a licensed counselor. You do need to call in and speak to somebody in order to be referred to a counselor, but it's 3 free face-to-face sessions per incident. So if my child is having trouble at school, they can get 3 free face-to-face sessions. And then if me and my spouse are having marital issues, we can also get 3 free face-to-face sessions. So it's 3 free sessions per incident. Next, you're going to have the ability to purchase disability insurance, 2 different types of disability insurance. The first one we're going to talk about is short-term disability. You can purchase insurance that will cover you and pay you if you are out of work due to not only an accident, but an illness as well. So as long as you are deemed unable to work, you're able to collect this benefit. The benefit will be 60% of your salary to a weekly maximum of $500. The next benefit is the long-term disability, which is going to pay you after the short-term disability runs out or after 90 days of being disabled. You are then going to qualify for 50% of your salary to $1,000 a month, and this is going to cover you until retirement age. So your short-term disability will pay for up to 6 months, and then your long-term disability will kick in after that. It is an excellent benefit, the long-term disability especially, but they are both great because if you are unable to work, you're going to have some kind of income coming in to help. Your bills don't stop when you're not working. The next thing that we're going to talk about is going to be the 401k, and I have Ryan on the line from our New Hampshire office, and he's going to take it away for us. Ryan?
Great. Thank you, Colleen. Good morning, everybody. As Colleen mentioned, my name is Ryan McLaughlin. I'm the advisor on the 401k plan here. And so what I wanted to do for the open enrollment webinar was just take a couple of minutes and just go through a quick overview of the 401k plan. Tiffany has my contact information, as does Colleen. I'm a resource to you, so if after this call you have any questions on how the plan works, on the investment options within the plan, or really anything financial planning related, feel free to reach out to me, call me, email me. I'm happy to help here all the time. So for purposes of the 401k plan, who is with the Vanguard, by the way, which is a very well-known, highly respected 401k, and you have a very generous match, which I'm going to go through in just a minute. This is a little bit different because it's outside of your open enrollment, and as Colleen mentioned earlier in her presentation, is the eligibility period is 12 months. And so once you've been employed for 12 months, and as long as you're age 21, you can join the first of any month. So if you want to come on the next month, September 1st, you can do so, or you could come on October 1st, November 1st, and so forth. You can change how much you're putting into the plan whenever you'd like as well, so you're not locked in for any period of time. But to quickly review your contribution options, you can do as little as 1% into the 401k plan, which is obviously a program that allows you to save for retirement. You can do as little as 1%, or you can go all the way up to 100% of pay if you wanted to. The IRS puts a maximum contribution for calendar years, and for the year 2020, the IRS has allowed individuals to put $19,500. So you can do as little as 1% up to 100, as long as you don't exceed $19,500. And then there is also what's called a catch-up contribution. So if you happen to be the age of 50 or older, you can do an additional $6,500 into the 401k plan as well. There are two types of contributions I just want to quickly review. You have a pre-tax contribution option, and so most people are familiar with these. Any money that you put in the 401k plan under the pre-tax deferral reduces your taxable income. So you get a deduction on taxes right away to put that money into the plan. That money will be invested into a variety of different investment options and then will grow over time. And then when you reach retirement age and start to take that money out, at that point in time, you pay tax on it because it has not been taxed yet. You also have what's called a Roth deferral option. This is a little bit newer. Not as many people know about it, but the difference is it's an after-tax contribution. So much like the pre-tax, you defer it out of your paycheck, it goes into the plan. You don't get any deduction to contribute, but the benefit is that when you retire and take that money out, all of the taxes have already been paid and you don't have to worry about it. So you have the ability to do some pre-tax if you want to get the deduction now, or you can do Roth and essentially be done with the taxes when you retire. So you can do one or the other. You can do a combination of both. You just can't go over the $19,500. And I did want to talk a little bit about the match. So a very generous match. The way that the match works here, it's 100% match of the first 3% that you would put in. And then there's a 50% match. So they're matching half of the next two. So if you do one, you're going to get a 1% match. 2 gets you 2, 3 gets you 3, 4 gets you 3.5, and 5 gets you 4. So if you want to maximize and make sure you're capturing all of the free money that's available, you'd want to be doing 5%. 5% will give you a 4% match. So that's very generous. And that money is actually 100% vested. So as soon as they put it in your account, it's yours, which is really nice. And just a couple other items, and I'll move on here. If you happen to have rollovers from other employers and you've got multiple statements you'd like to consolidate, I'm happy to help walk through that process. Feel free to reach out. I'll point you in the direction as far as which forms you need, help you complete those, and walk you through that whole process from start to finish. And really, I think that is about it. If you do have any questions, let me know. If to enroll in the plan, I will mention that. The website is www.mymyvanguardplan.com, and that information is actually in the back of this booklet. So feel free to go to the website if you'd like to enroll. It is all done on the website. There's also an 800 number there as well. But if you have questions or having any trouble, please reach out to me. And with that, I will turn it back over to Colleen.
Thank you, Ryan. So we're going to just take a couple more minutes and review the rest of the benefits. You have access to My Benefits Work, which is an entire package of benefits provided to you. Within the package, there's a teledoc benefit that will always cost you nothing to use. And Unlike the other teledoc where the fee is temporarily waived, you must be enrolled in the medical in order to use that. This is a standalone package, so you can enroll yourself and then your covered dependents, including your children, even if they're not on your medical plan, they'll have access to the teledoc services free of charge. You also have pet care where you can get discounts on not only veterinary services, but any medications, doggy daycare, house sitting, and the like. Also, Compass navigation, which is a big thing that we spoke about last year, and we're going to talk about this again this year. The Compass navigation is a tool that will allow you to call in a licensed navigator, quote unquote, will help you locate a doctor participating in your plan. If you become diagnosed with a condition, they're able to walk you through and find some alternative care and treatment if that's what you're looking for, provide you with some articles on how you can manage it naturally. If you receive a bill, the navigator can actually review your bill and they'll advise whether or not you do owe that money, especially with hospitalizations. You get a whole bunch of bills coming in all at the same time, and it can be very confusing. The navigator's there. They are there to help you. I did want to let you know that the Compass navigation piece is also known as All Light, brand new naming. So if you see that being referred to as All Light, it is referring to the Compass navigator piece. Also, alternative medicine. Some people are choosing to take a more holistic, natural approach. While it's not covered by your traditional medical policy, you can get discounts of anywhere from 10 to 30% with a variety of different things, including acupuncture, holistic medications, etc. Not going to go through all of the benefits because you can definitely read them. And again, they are just the same as last year, with the exception of the counseling services and the financial helpline. These are two new benefits provided to you within the package. Counseling services 24/7 available to you. You're able to talk through some things, especially right now. I know a lot of people are dealing with a little more anxiety or stress due to the current global pandemic. So please do not hesitate to reach out. That's what the counselors are there for. Also, the financial helpline. They can help you plan for your retirement, budgeting, debt consolidation, etc. All of the services are provided in the one package for a cost of $311 a week. Page number 11 is going to review the two different apps and how you register for the app. If you're already registered, then you will obviously just log in as usual. Nothing is changing. Page number 12 talks a little bit more in detail about the Compass Navigator. And the last page is going to go over your online enrollment instructions. If you are a new user, you're going to go to employeenavigator.com. You're going to click on login in the top right-hand corner. You're going to register as a new user. You're going to enter your information, first name, last name, PIN numbers, the last four of your social, your date of birth. The company identifier is Benchmark Games, Inc. It is case sensitive. Benchmark with a capital B, Games with a capital G, Inc. is INC, period. It is important that you enter it exactly as it is on the screen, or you will not be able to enroll. If it says cannot locate the user, please reach out to either myself or Debbie. Once you're in the screen, it's going to look like this, except instead of finish enrollment, it's going to say start enrollment. However, I've gone through the site just to make sure everything is working. So you are going to click on start enrollment, get started. and you're going to walk through screen by screen. It's going to be save and continue once you confirm your information. If your address is still the same, you're going to hit save and continue. Otherwise, you're going to hit edit, update your address. It is then going to take you screen by screen through all of your different benefits. You're going to click on who you want to enroll. So if it's just yourself, there should be no check mark next to the dependent's name. Otherwise, you're going to make sure there is a little green check mark next to the individual you wish to enroll. You can click on compare under the medical plan, and it will give you all of the different payroll deductions and all of the benefits side by side, a nice little comparison for you. You're going to pick the plan that you want by hitting select, scrolling down to the bottom, and then hitting save and continue. If you do not want to enroll in a benefit, you're going to click on do not want this benefit and choose the reason you're declining the coverage. Another thing I wanted to point out over here is going to be your My Selections. Top right-hand corner, it's going to tell you what you're currently enrolled in and then the plan that you're electing at open enrollment. Once you go through all of the different pages, you're going to go to the enrollment summary. It will be a little save, sign and save over here, or it's going to say enrollment not complete. So enrollment is not complete over here because when I elected the voluntary life insurance, I didn't choose a beneficiary. So once I go back and I name the beneficiary, they'll all have green checks and I'll be able to sign my enrollment. Referring back to the benefit guide, the bottom of the last page, I did just want to make sure everybody saw all of the contact information for the carriers, including phone numbers, and website or email addresses. Doesn't matter if you know the answer as long as you know where to find it. So that makes this contact section the most important thing. And again, Debbie Rito and myself, Colleen Hernandez, we are here to help. So please do not hesitate to reach out with any questions that you may have. So thank you very much for joining me today, and I hope you have a great day. Thank you.